I'm going to just now spend a few minutes before the breakout session, and this is basically what happens when you get to run your own conference. I'm going to completely, own this and say, I'm going to talk to you about some things I've been dreaming about. Not the only thing I've been dreaming about, but about what a national call to action might look like. Not because I'm right, but because I get the stage, and sorry, you're all locked in just now. But each of us has no more import on what our national calls to action are than anyone else. But I'm on the stage and you're not, so apologies about that. So if you could just put up with a few minutes of me talking about it. So when I came up with what the theme should be today, which is emerging local evidence, national call to action, what I had in mind was this. I really think there's like a moral imperative on this, like an integrity thing about saying when we're working at the front line, and then when we're working in teams, when you're managing people at the front line, when you're then coming together into collaborations and network, it's incumbent on you to be thinking, what am I learning that's actually useful further up the way? It is important to think, how do I learn and adapt in the space I'm already at? If that's a team level, for us a neighbourhood level, it's incumbent to be thinking, what else can be taken from this, okay? And not because any of us have the answer, but because if we're not sometimes putting ourselves in that chat, then we accidentally leave it to people who sit in the back rooms somewhere else to have that chat, often when writing a policy manifesto or something like that. We need to just have a wee chat with each other about these things. So I thought, there's a national call to action, but is it just me? And I ammed and ahed about how to do this, and I came up with an amazing solution, which is I added a question mark to the agenda item. Is there a national call to action? I don't know, maybe. Let's have a chat about it instead. So that is to say, I'm not as caught up as this next few minutes might make it seem in my own thoughts. So, sorry, I put the wrong button there. Right. I think this is our current national approach. I'm deliberately being a bit provocative and unnecessarily mean to people who've done unbelievably hard work over many decades. This is our current national approach to lifting neighbourhoods out of poverty. So our key approach is to knock them down. That's a major approach. If you actually look at the map of where in Scotland neighbourhoods have lifted out of poverty since the indices of multiple deprivation being used, broadly you're looking at places where it got knocked down and the people got moved to other places. So it dilutes the problem. That's great. Good move. There are things you can do in that space. There's definitely good practice in this. It's not that all capital spend is useless. It's not that if lifting a neighbourhood out of poverty means it still needs to look really awful. Like a lot of the neighbourhoods we work in, they look awful. They need some change in capital spend in them. Fundamentally might mean poorly designed, if you see what I mean. That is something we can deal with. But, broadly our approach is kind of knock it down. The other is to hope, there's cliche of a rising tide lifts all ships. So through the, what in inverted commas, good years on my graph earlier about mobility, mortality, through the good years, we'll call them the new Labour years, but really it's the pre-austerity years, so who knows where that would have gone. But certainly a sinking tide really does ruin a lot of people's lives very quickly. There's no two ways about it. Macroeconomic effects, the big budgetary stuff, have increasingly led to that inequality, have entrenched neighbourhoods in poverty, and have made the people who already were at biggest risk of persistent poverty much more likely to experience it. But this sense of, like, if we can just get on with some of this national growth stuff, and this isn't just a UK government issue, this national growth stuff, that'll sort it out. Even in Edinburgh, we are at risk of talking about these things sometimes. If we could just kind of do an Edinburgh-wide bit, that'll kind of sort it out, won't we? I think there's some bits where that is true. How we can give more universal benefits or more generous targeted benefits to people. There is something in that. But there's a lot of weight in there. There's a lot of just crossing our fingers and hoping the problem will go away, or maybe we'll leave it, if Jim could just deal with this, that'd be great. We'll just get on with our local authority stuff. So there's kind of maybe someone else will step in and fill this gap. Maybe philanthropy has a role there. Yeah, maybe it does, but there's a bit of wait and see. And there's a little bit, sorry, I've sort of blocked this out. This is my terrible little joke about saying, broadly, the people who look outside at how complex the situation is and say, are you sure that 3-step plan that the minister set out is enough to really make a difference here, to have a just economy? Well, the people who step out and say, actually, the world is really complicated, how are we going to do this? They kind of just get shot down or burn out through trying to fight against the tide of the conversation that says, maybe it's a bit more straightforward than that. So I've got 3 slides, I think it is, of where I think there's something we could start to find some lessons that I would want to be in that national discussion. The first is, I think a few of the people talking this morning and a few that were invited and couldn't come are mentioned here. And there could be dozens of other people on this, but these are the ones that were kind of conference adjacent, I'll call them. I think there's a shared experience that they're talking about there, that before you even get started trying to lift neighbourhoods out of poverty and make change in that direction, if places lack community anchor organisations, apologies that that's a bit jargony, but I'm sure most of you get it. If there's a lack of locally led community work that spans multidisciplinary working in a community, then kind of some coordination effort is needed at neighbourhood level to unlock hidden assets, get the ball rolling, just to be an enabler. Before any of the rest of it starts, it's a sort of precondition. And actually, affluent communities often have this. You know, we talk about community development in deprived communities often, and in affluent communities we're like, oh, it's just this stuff that happens in the margins and no one ever mentions it. So is that a precondition? I'm going to posit today, because I'm in this bit where we're just in a bit of a dream space, I'm going to posit that's true. Sure. It might not be, but let's just say there's a precondition there for lifting neighbourhoods out of poverty about having that early work put in place. Look, I've got Jim's picture on here because I was hoping he would say something relevant this morning, and he did. So I gambled on that one. Is there a bit of a consensus with lots of people saying there's like an approach to transforming lives of individuals based on strengths and relationships can be delivered in a place-based approach? I was basically going to Jim this morning and saying, is there something you could say about like good practice and hope? Yeah, there we go, that's where we ended. Is there some hope in this? And I think if you look at a few other people's models of where they're either themselves bringing good ideas or they're bringing up, as Jim did this morning, other people's good work, we can see good practice that means that there is reason to think that place-based approaches built on strengths and relationships can work. Of course there is. It's happening everywhere. It's just, is it happening in all the right places in all the right times and funded in a way that makes it happen? These are some of the ones I think are particularly important. If you haven't read Hilary Cottam's book on the far left-hand side there, that's what you should be reading tonight. It's brilliant. Nothing to do with us. How brilliant to read people doing the same kind of approach. The local coordination stuff, we will get you in front of it eventually. This is the second time today I've said it's really important that Ralph and the people who do local coordination come out. They have lots of good examples of doing things like lifting neighbourhoods together, small scale, but in hundreds of places. Can it work? Well, the commissioning part of this is tough. We had Jim this morning talk about actually, you know, people working in that philanthropy space can get their head around how this might work, that you might commission or fund in a different way. And actually, if you want to talk about public sector spend, I can't go on enough about the human learning systems and the fact that they're starting to give answers for how you can do the next bit. Sat in a meeting the other week in North Edinburgh, and there's a whole call from the network we have there of partners, and we said, what you need to do is give us more unrestricted funds rather than give us lots and lots of restricted funds. And one of the councillors reasonably said, I'm in the governance oversight. How would that even work? And I was literally able to go, I'll text you the details of people who can tell you the actual answers to that question. And having that in your back pocket is fantastic. And this third and final slide in this wee section is, I think this is obvious. Look, does anyone debate really, apart from the like nuance of these things, that early intervention's needed, that prevention approach is needed down the line, that an equity-based approach, I resisted that beautiful picture explaining equity versus equality, the cartoon, just because everyone has seen it before, I hope. But the fact that there's a wee difference between trying to do the same thing everywhere versus really honing in on the places that need support, the people that need support, particularly when you're talking about early intervention prevention, is really important. Are we doing enough of this? Well, I think surely there's a consensus. So if we have some national asks, they've got to be in this space. And my little comment on that equity bit is, I sat in a meeting the other day where someone said, I'll paraphrase so they're not kind of picked out too much, but this is something like, the most important thing I can think we could do at the minute is make it so every single part of Edinburgh had the same community food project delivery. And I thought, so hang on, this is about getting crisis food into people who are in poverty. It doesn't feel like the most, that feels like we're starting to fish people out here, but also having something the same across a city means you cannot be building on assets, whether you're like, oh, we can make volunteers build in this place, we've got physical community assets in this particular neighbourhood, let's make something really good out of that. And instead is trying to make it kind of more simple on a piece of paper to be like, I know the 3 places I can refer someone. Why does that person need it in the background? So I think there's a consensus around saying an equity-based approach where we really pile into places is important. It is kind of taken for granted that an asset-based approach is great, as I said in the previous slide, but actually does that all come through? If you just glance briefly at Marmot, Christie Commission, Realistic Medicine, the Vision 2020 stuff that the NHS piled on, these things are surely baked in now. So our national asks have to be something to do with that. So surely, I tried to get all my photos needed to be royalty free, and the flippin' Oliver film, which is what I'm aiming for here, is not royalty free picture, so we've got this old one. So how do we have a national ask that's anything apart from, can we just have some more money? I'm not going to stay away from this. I think we should have some more money. That's where I'm headed. But like, what's a reasonable way of saying there should be more money, and why that's come out of our learning, as opposed to just being like, of course there should be more money. Of course public services need better funding. Of course the third sector responses do. Of course the neighbourhoods do. And I think part of that is me starting to say, are we getting to the right people in the right places with the money we have? If there's gaps in the public sector provision everywhere, why is it that needs to fall disproportionately on the neighbourhoods where the poorest people are? Because they're the ones who are so much more dependent on those services. We've got great sense of universalism in some of our public services, but actually it means that sometimes the gaps end up being much bigger in the very places that need it. And this is why on that graph, the inequality is massively growing. The gap between life expectancy of the poorest and the most affluent is suddenly growing greatly. So in some ways I'm not going to stay away from this, but we shouldn't worry too much for today's argument about just having an ask that's like, a bit more money would help. Not for us, not for you, for like the neighbourhoods in which we want to see change happen if they're going to be lifted out of poverty. So this is a slide I used this morning, so I'm not going to say, so what if instead of these things that are saying kind of siloed, lots of delivery that's in a fix-it paradigm that kind of gets stuck in trenches rather than prevents this. What if instead we had a project, a national project, sorry, project makes it sound like another one of those 3 O's one. What if we had a national mission for 10 years or something like that? Okay, and this, please don't do this is just me dreaming. The kind of did these 4 things, and the first 3 are sort of in order. So the first is, I've got this there's a whole interesting bit you could learn about people who use microrhizomes there as a kind of analogy for bits of asset-based community development. But really I'm trying to say there's a job that can be done in coordinating and connecting communities towards community development, setting up the community anchor groups, setting up community activists, if this was a true microrhizome, there'd be lots of different mushrooms blooming between those trees, by the way. So like that can create new stuff independently of us by just having made the connection in a really, really deep way. And also in a really uncredited way, it's worth saying. Community development is nothing if not modest in being like, we shouldn't take the glory for all of the things that communities achieve. This is my way of saying there's a precondition, this is what we just said, where a community can't be lifted out of poverty, I think, unless there's been some pre-work to build up community capacity, community connections, community anchors. Okay? So imagine there was some sort of national mission which said, okay, for poor neighbourhoods, we're going to make sure there's no one missing out on that. Well, this morning we heard Cora doing that in some places. We heard around climate, Laura and the Climate Action Town stuff doing that. Finding the places where that's not happening, going in. What if we were more systematic about that? What if we had locally delivered, open, relational-based support? Again, it doesn't have to be our model. There's loads of models out there, but where there was people freed up. It doesn't have to be loads of people, but there was at least some people freed up from the baggage of having a particular specialism mentality or having a particular KPI. And that was in, say, every deprived neighbourhood, that there was at least a few kind of lone wolves, we'll call them, out there available to help people in all sorts of ways. And the last bit is by far the most expensive, and this is why I'm not the right person to talk about it. But what if the gaps in public services that we know we have, and by the way, we know will continue to arise for decades to come, because there's no way out of this. This isn't a temporary crisis. What if they were plugged, right? But instead of trying to plug them from some top-down way, where we say, let's make sure there's no mental health waiting lists in Edinburgh. That is both hard, expensive, and not an equity-based approach. What if instead we were saying, well, maybe the places that most need this support, where there's the most persistent poverty, the most entrenched poverty, they could be front of the queue for where the services came in. And at the minute, those communities suffer from this paradigm. They're like, please can we have more mental health support? Please can we have more community food support, actually? Please can we have more support around social work, so it's not always such a disaster where it's almost like a punishment in social work. It's actually genuine about helping people. Those communities are waiting for money or resources from the public sector to come in. What if instead it was the other way around, that we were putting money in, and look, I don't like participatory budgeting, but I like the idea that's behind participatory budgeting. What if it was actually that the public in those communities and the community anchor organisations supporting them were buying in public sector support to plug those gaps? Not setting up their own thing, because if you set up your own thing, you're a new sticking plaster on top, you're probably a 3-year project. You know, it's in the third sector, it's great. What if instead we were buying people in who were connected to that? So something I'm interested in how we experiment with this year and in the next few years is saying, what if we paid like half of the money that it costs to get a debt advisor in, for instance? And we went to the council and said, well, we'll pay some of the money for them. You pay some of the money, but that person will then work in this neighbourhood exclusively. You can easily fill their entire working life for 2 years with the debt in this one community. But we can be part targeting it, and the community can be in charge of saying, that's the bit of the public sector that we need just now. So this is my dream, not yours, right? You don't need to agree with me. And I think this should all, by the way, be done in a way in which is based on trust, about our learning cycles, and we really try to make sure that's the system. So if I was costing this up, right, imagine, right, so I've just been given all the money in the world. These are the costs I assigned to these things. These are completely random. I came up with these, I think last night, actually, now I think about it. So don't think they're right. I don't think they're right. But if we spent something like £30 per person in a neighbourhood on projects that are about capacity building, that's about the same as the ones you've heard. Of the 6 examples I had on my other slide, that's about the right order of magnitude. What if we had some people doing relational work that's free of the rest of the system? Yeah, I had a bash. This not a million miles off the kind of costs of some of the projects that I was referencing that have kind of the same ethos that I'm aware of. Completely made up a number for public sector, but I only wanted to, you know, what we could pay to buy in. I wanted to draw attention to 2 things. One is, the bit where the public sector needs gaps filling is by far the most important bit in terms of cost. It's clearly much more expensive than having a couple of caseworkers who are freed up. That's actually why some of the system change stuff's so hard, because that's the bit that's massive and difficult and quite fragile. So if we were trying to do this, so I just £30 a person in a neighbourhood, £50 a person, it sounds all very sensible. If we did this for the poorest 100 neighbourhoods, right, I've just made like a nearly £1 billion 10-year project. So this is bonkers, right? I'm not going to spend £1 billion in the next. This is just Edinburgh, by the way, because if you zoom out too far on. Right? So if we did it in 100 for Scotland, we did it in 100 most deprived neighbourhoods in Scotland, where it's sort of a cohesive neighbourhood. Some deprived areas, it's less cohesive in terms of whether you could deliver. And we did a bit of work that was about the kind of ABCD capacity building, which I've got as, in my analogy, is kind of that rhizome stuff, that building community anchors. We made sure there was some flexible resource in the area. We made sure there was money to buy in other services. So these are disproportionately expensive. These are massive costs all of a sudden, even though a minute ago I was just saying £30 a person, £50 a person, £100 a person. These are small amounts. If you were thinking about the project you deliver and how much you spend per person, that actually sound quite small. But actually, it's huge. But my challenge, I suppose, is to say, in my dream scenario, 100 neighbourhoods across the whole of Scotland do get supported in that way, over a 10-year kind of commitment. I'm just using Gordon's number because it's convenient to say a 10-year commitment, with a plan to exit and say, we're trying to change the system, we're not trying to be in there to get our hands dirty forever, because these places should be lifting out of poverty, so we should be making ourselves redundant. We should be making it that the community takes it forward.